So really appreciate everyone coming. I'm going to start off. I've got about 30 minutes of talking, but this is interactive, and I want to start off with the first thing. The goal here is for everyone's hand to be down, so let's just start. Do you have insurance? Raise your hand. Do you know what a copay is? If you don't, put your hand down. Do you know what a deductible is? Put your hand down if you don't. Co-insurance, TAP, in-network, out-of-network, balance billing. Oh, wow, there's still some people with their hands. Okay, I got to do a different one. Prior authorization. You guys are in health. Oh no, keep it down. If you've already put your hand down, keep it down. Actually, you guys don't count. You guys are in healthcare. Is your name Shaun? Put your hand down. All right. So, reason I did that is more and more of the costs are going to be borne by us as individuals. This is no offense to anyone that's insurance, a physician, but we have to be better at managing our own healthcare if we want to still have healthcare when we need it. There's a couple stats I want to throw out. By 2022, I think is a new number, Medicare will run out. It's very important to note that. I don't think I'm going to be Medicare eligible by 2022. Unless costs go down or costs stabilize, or there's a tax surplus, which also we won't like here, we may or may not have Medicare by 2022. Another stat I want to throw out is 1 in 5 of us have a deductible that's greater than $1,200. 1 in 4 of us don't have enough in our checking or savings to pay for that deductible, and so 1 in 3 of us are avoiding getting health care. So those are a lot of things that are happening in healthcare right now. Is $3 trillion, the largest part of GDP, and until we as consumers and individuals start to take healthcare into our own hands, we have a big problem. So with recognition of the great book by Eric Topol, The Patient Will See You Now, what my talk is about how empowered consumers will transform healthcare. So I want to start off with a clip, I hope it plays, talking about healthcare.
Difficult. Elaine, you should be reading that. Now tell me about this rash of yours.
Well, it's, you know, I noticed that someone wrote in my chart that I was difficult in January of '92, and I have to tell you, I remember that appointment exactly. You see, this nurse had asked me to put a gown on, but it was a mole on my shoulder, and actually I specifically worn a tank top so that I wouldn't have to put a gown on. You know, they're made of paper.
Well, that was a long time ago. How about if I just erase it? Now, about that rash.
But it was an N. Fake erase.
All right, Miss Ennis. This doesn't look too serious. You should be fine.
What are you writing?
So this is like a lot of our healthcare experiences. You're a patient, not a consumer when you walk into the doctor's office, but with reference to The Patient Will See You Now by Eric Topol, some of you might know him because he gave Stephen Colbert a real-time ear test on Colbert Report. But he's a brilliant guy, came from Cleveland Clinic, now runs the Scripps Medical Center in UCSD. But some quotes from his book: every patient is an expert in their own chosen field, namely themselves and their own health. Healthcare will be less frustrating when the power shifts from sellers to buyers, and when the patients are more in charge. David Cutler, who's at Harvard University and a very big thought leader within healthcare and healthcare policy. And it is no exaggeration to say that billions of people will soon have a printing press, reference libraries, school, and computer all in their fingertips, the smartphone. So this is my abbreviated history of medicine. Until about 1980, it was the doctor knows best. But if you're a doctor, what happened in the 80s, probably until 2010, is your insurance actually knew better than you. And there was insurance that really drove a lot of what happens in practice, but also it was to balance cost with care. But what's happened in the 2010s, and all of the stats here, not to really get into it, is if you look at any line going up, that's the amount of cost we as individuals are now bearing for our own health care. And that number, that trend will only continue to go up as a way to push more of the cost off the system into us as individuals. And that's the way healthcare costs will start to slow down, is if we bear the cost, but that requires us to be very educated consumers around healthcare. And I'm going to spend the next maybe 20, 25 minutes on these topics. What do connected consumers look like? Connected devices, connected healthcare. I don't want to be a spoiler, but basically everything is connected, but nothing is coming out of it. The consumer journey. I spent 7 years at Walmart at Bentonville, actually at the largest retailer in the world, and we really thought about everything from how the consumer comes in, what they shop, price, product, promotion, placement, and it was very scientific, and marketing has really become a science, and I'm going to apply that same framework into healthcare so you folks can start to have some tools to take away and be smart, empowered healthcare consumers. And then the fifth thing is what we as Ardina, we really want to help empower you with education, tips, so you can be smarter when you get healthcare for you and your family. Connected consumers, everyone here has a smartphone, I imagine. And that's only going to continue to rise. And I love these images because I think this is called hanging out nowadays. You just sit next to your friends talking to each other over your phone. But everyone uses the phone as a way of communication, whether it's social media, whether it's looking up information. You have so much at your fingertips. We all have that as consumers. And in healthcare, actually, there's a ton of information that we've never had before, whether you're using a Fitbit or an Apple Watch, using software like MyFitnessPal or Nike Plus, and there's a lot of connected devices that are coming in. Two in town in Columbus is Beam, which is a Drive Capital company that's really trying to improve oral health and actually lower dental insurance, and Caring Things, which is a crowdfunded campaign on thermometers, and they're going to start to roll out more and more connected smart devices. So the consumers are connected, the devices are connected, and many people might not believe this unless you've been to a doctor recently. Your doctor's connected too. If you've noticed, this is the way healthcare is delivered in the doctor's office today. The doctor's talking and speaking to a screen while you're telling him what to put in there. The dentist is using a screen. The pharmacist speaks to a screen. The radiologist reviews a screen. Healthcare is connected. So it's not a matter, my whole point with all of this is it's not so much that connectivity, data, information, that is not what's holding back healthcare. It's actually the one most important person in healthcare is being underutilized, us, the individual. I used the terms in the beginning to basically explain to you what healthcare almost does to confuse you. It's a very, very, very confusing industry, but I also believe it's kept confusing in order to keep doctors here, insurance here, and individuals a little bit kept out. So the rest of my talk is really around how can you as individuals take control of your healthcare, and that's my goal. Any questions, any ideas? Challenges, challenge me if you don't think this, or you have a different idea. I'd love to hear your feedback. Yeah?
Do you think the confusion that you just referred to is intentional, or do you think it's just because everyone's operating in their own silo?
I'm a little bit of a cynic. I think it's intentional. Because deductibles didn't exist before, co-insurance didn't exist before, until costs started to go too much to the insurance and they wanted to push it back. What's happened right now, and I got a bill for this, my son was born, we went to a hospital that was in network, but lo and behold, during the C-section, a doctor saw my wife, who was out of network. How was I to know that? But now I had a bill that was about a couple thousand more than it should have been. So there's a lot of things that happen in order to really risk share, which is what insurance does, but a lot of it takes us knowing how to do it. That's an extreme case because I was not going to tell the surgeon, get out, you're not in network, but if you're going to get a knee replacement, a wisdom teeth pull, there's a lot of things we can do to kind of manage our own healthcare ahead of time. So the problem, well, it's bad. The problem with healthcare is that the healthcare system traps all of the data. There's a lot of information there, but the data is trapped inside of healthcare. The solution, though, is getting the data into information to empower all of you. But then the goal of healthcare really should be transform patients into consumers. Consumerism has transformed every industry. If you think about travel agencies, Orbitz, Expedia, even United, Delta, they all came on board where you can actually shop for your own vacation. I mean, if you rewind pre-internet days, that was unheard of. You always had a travel agent. Brokerages, E-Trade, Scottrade, they allowed you to make your own trade, and that actually drove the economy because money that was sitting on the sideline was now put into the markets. The thing about healthcare is the data continues to be trapped in the system, and the jargon is so confusing that a lot of us are stuck trying to figure out what does a balanced billing mean? What is a coinsurance? I don't even know what my health insurance is, so what I try to do is run, stay healthy, stay fit, and just avoid the system altogether. So this goes back to the framework of how consumerism really happens. So there's something called the path to purchase. I was a merchant at Walmart for a number of years, and this is what we worried about, what we thought about, and how we get the product into your hands. A little bit of marketing, but a lot of it was science. So first thing is, I have a problem. Second thing is, I go somewhere for information. The third is, I evaluate the alternatives. 4 is, I make a purchase, and that's where the retailer comes in. But the 5th that's happening more and more online is, I can now see, am I getting the results I expected out of that purchase? So this is called the path to purchase, and if we put that framework into healthcare, I'll start to share with you some of the tools that all of us should start to think about when we have a healthcare need. Problem recognition. Is it my joints? Is it my circulatory system? Is it my lungs? Is it my stomach? Is it my muscle? We all know when we have a problem, right? But then what do we do about it? All of us start online. It's Dr. Google these days, right? 72% of internet users said they looked online for health information, and 77% started on a search engine, most likely Google. So there are a lot of tools, and when you have a symptom, I would go on WebMD, there's a symptom tracker. Or look up Cleveland Clinic and Mayo Clinic. Everyday Health does a lot of consumer education and tips. Next step is around cost. There's a lot of these companies that are coming out. Healthcare Blue Book is one of the largest, but Deductible, Pocket Doc, Castlight, HealthSpark, GoodRx, Brighter, and many, many more are trying to get cost transparency. And then there's agencies by the government and for-profit companies like HealthGrades that are trying to give you transparency around quality. With the quality, NCQA and NAHQ are trying to standardize what quality is in healthcare, whereas HealthGrades and RateMD are trying to track how those doctors or hospitals perform against those quality metrics. But Yelp and Facebook still is a place where we look for advice or recommendations for who to see as a doctor, a chiropractor, or a dentist. The challenge I see with all of this is it's extremely confusing and different pieces of the puzzle, which is why I think we still go back to Google. But there's a lot of things, if you can start to use some of these tools, Healthcare Blue Book is phenomenal. If you put in, if you're gonna have elective knee surgery, wisdom teeth extracted, and you put that in there with your zip code, you're gonna start to have a sense of what costs are around you. You'd be surprised that this MRI costs this much at this zip code, maybe Riverside, and it costs this much at Ohio State. You'd just be very surprised at how different rates are. So information search is where we go next after we know we have a problem. And in healthcare, I wish there were more alternatives. Usually nothing is what most of us will do until it's too late. If you're sick, I just stay in bed. Or it's not bad today, I'll deal with it later. So in healthcare, if you think about this as the alternative, and many of us are doing this, it will only compound the issue, because a lot of times the cure and finding a solution is a lot more difficult than in other industries. But then the purchase decision. Really the two things that happen is who's covered by my insurance and then who's available. So I just threw up our locator tool for Ardina. What we know is most people want to know who's in my network. That's how I start to find out which dentist I can go to. But then the next thing is I wanted to get a primary care doctor. I found out who's in network, and then I spent a day trying to call, are you accepting new patients? Are you accepting new patients? And the answer was always no. So ZocDoc actually allows you to have availability on who's available for appointments within your zip code, within the specialty you're looking for. And then the last one is a post-purchase decision. Healthcare is the only industry that I'm very familiar with where you don't know what you're going to be billed until 3 months after you got the procedure, and there's no such thing as returns. You just can't give back the crown, you can't give back the back surgery. You just have no idea until you have the procedure. And this is the reason I started Ardina. Every time I got an explanation of benefits, I had a high deductible, I always saw my plan paying $0. And it was just the most frustrating thing. I was paying about $1,000 a month in premiums for the privilege of a nice letter that tells me they paid nothing. Because luckily I was never sick, and if I needed it, that's great, I have insurance, but for the majority of everything I needed to stay healthy or get better, I didn't have insurance. So a lot of times, this is what we're trying to evaluate for the post-purchase decision, but you and I know, did the surgery work? Did I like that doctor? Did I like that dentist? And healthcare, again, if I go back to this, if you were to evaluate tires, get an oil change, get your windshield repair, you can start to do this a lot simpler because the information is available. There are providers that help you with your car. It's just when it comes to healthcare, it's either confusing, there's no information, but I want to make sure you realize there are tools that can help you go through this. And what I wanted to share at the end is we're a startup, but really what we want to do is empower you folks to take measures into your own hands. And the things that we as consumers want to evaluate is saving time or saving money. It's got to be convenient and it's got to be affordable. And so what we're starting to do is develop a lot of content, YouTube videos, blog posts, really around how do I save time or how do I save money at the doctor? How do I save time? How do I save money at the pharmacy? We've done our research, and interestingly, other than maybe a USA Today article that comes out, or maybe someone that wanted to share a blog, there hasn't been any consistent information out there to empower consumers to take healthcare into their own hands, and time and money are the easiest quantifiable ways for us to evaluate healthcare. And so we're putting out content. How do you avoid the ER and urgent care? How do you use retail clinics and telemedicine effectively? How do you negotiate a bill with the dentist if you don't have dental insurance? So those are the type of things that we're going to be rolling out with our information with Ardina. But doctor, pharmacy, dental, lab, vision are kind of the crux we use to stay healthy when there's cost and quality transparency. So the NHS in the UK has a system for what they view to approve a drug and what it's going to cost. There's a lot more transparency at the decision maker level. Instead, it's a free market in the US, and competition to some degree drives cost, drives profits, etc. I don't know if I just look at those two different business models and one has information and the other doesn't. Guess how much we submitted to the insurance, and guess how much we got back from the insurance?
50%.
Wow, that's generous, the insurance. Right now, the pharmacy is getting 8% of what they submit to the insurance company. So if I submitted the drug for 100, I got $8 reimbursed by the government, by the insurance company. So the interesting thing though is, what's the role of insurance if you can get the $8 as a consumer? So my company is really, Ardina is giving you that $8 rate without having to go through the insurance.
But you can get that from Medicare, but how do you get that from private insurance?
That's why Ardina has we think has an opportunity. Yeah. So, but to your point around, healthcare costs are very opaque, but I think that illustration is, it's not a real number. What you and I care about is what we pay out of pocket. And so even knowing how to negotiate a bill, even knowing what the costs could be, is way more powerful than what does my insurance cover. especially if we're exposed to more of the cost because of deductible. That's where healthcare cost and perhaps healthcare quality will be going. But for many of us, I hope we're not going to the hospital this year. So for many of us, we just care, can we see a doctor when we need one? Can I afford to get this procedure if I need it? Does that answer your question? Does that help?
Yes.
Yeah.
Okay.
Okay, thanks. Thank you. Yeah. What other questions? I hope to not get into policy and elections here, but if you have. Yeah.
I had been in advertising back in the 80s when farmers wanted to get rid of the same kind of thing, to get rid of the opacity in healthcare. What do we have to do to move forward? Is there anything we can do legislatively or as a group?
The best thing that's happened right now is the data went from paper into computers. So the data is available, and there's a lot of companies that are actually extracting that data. In fact, health grades, what I understand, it gets information directly from what's submitted through NCQA. So you're getting government data just in a much more usable format. So I think it's a matter of time before it becomes mainstream. But the challenge right now is you as consumers, or us as consumers, I'm included, we don't know what we're supposed to be looking for, but the tools are available. I think there's going to be a lot of, there's going to be a Google that emerges from all of these. There's probably, on the cost side of the equation, there's a bunch of companies that are worth $1 billion or more in this list, but I do believe a Google will emerge if you're looking for costs on a procedure, or a Google will emerge on which trusted quality website should I go to? And I just think it's a matter of time. I don't think that's a good answer, but I do think the market will start to help sort that out so you know what you need. Yeah.
So is Ardina's primary focus or exclusive focus on the cost of healthcare and educating patients?
Cost and access. Yeah. Because right now the insight that we have, there's 47 million uninsured, but there's 31 million underinsured, and the underinsured have a high deductible. That's almost a third of the, maybe a fourth of Americans that are either bearing the cost of healthcare or going without healthcare, and that's what at least my company is trying to solve and help those. So what we built is an online marketplace for out-of-pocket healthcare. And so we're not going after the hospitalization, we're not going after the surgeries, we're going after the things you and I need from healthcare on a day-to-day basis. Whether it's a strep throat, dental visits, vision visit, chiropractor visit, lab, or prescription. We want to be on that other spectrum. Insurance is great if you go in a hospital and you need it, and you also need it regulatory, just like car insurance, but you're paying for everything out of pocket, and that's where we built this marketplace that we're calling the AAA for healthcare. I've also heard people say Costco for healthcare. It makes sense. And what we've done is, rather than giving you the $100, if you walked up to the pharmacy, you would pay $100 if you didn't have insurance. Funny, because when I was at Walmart, I got $8. I'm just as happy at Walmart when I was running contracting to get $8, because I think most times a person walks away if they can't afford $100 for their prescription. So what we've done is contracted with these networks, and we're not insurance, but we give you the same rates as if you did have insurance for dental, vision, chiropractor, lab, and prescription, in addition to unlimited free primary care through telemedicine. And what we've tried to do is keep it affordable at $10 a month for your entire family, so you can get the care you need when you need it.
Can I check one more thing? How does Ardina get money? How do you get money? Who pays? Do I pay as a consumer? Does my company pay to become part of your network for my employees?
Thanks. So either you sign up online and it covers your family, or your employer offers it to you as a benefit. Either they pay or you pay through payroll.
So anybody here today could walk out of here, go to your website, and sign up for your service?
Yep, correct.
How much does that cost for an individual or for a family of four?
So $10 a month gives you unlimited primary care for your whole family. $20 a month gives you the primary care plus dental, vision, chiropractor, lab. We split it because some people have dental insurance, some people have vision insurance, but most of us pay when we see a doctor, and that's why we wanted it in both packages. 10 or 20 a month for the whole family.
So if I understand correctly, you said this is not insurance. It sounds like it's a complement to a catastrophic plan. Is that correct?
AAA for health care.
Okay.
So if you think of the analogy of car insurance, we all know we don't want to get in an accident. We all know they won't pay for our tires, flat tires, or windshield oil change. So we do our best to be a good driver. In healthcare, it's not like that.
Yeah.
But we now have an incentive because we're paying more of the cost to be a good, healthy person. Yeah. Yeah, thanks, Neil. Yeah.
Shaun, just a quick question.
Yeah.
So you're trying to fill that gap on
Yep.
deductible plans, but from what I've seen in a lot of the plans now, especially when you look at the marketplace, is they're starting to offer, I don't want to say free,
Sure.
but, primary care coverage.
Sure.
So if you need to go to, the doctor for, once a year,
Sure.
have your normal labs, et cetera. So where are you picking up beyond that? Or
Yep.
is that going to eat into your business model? I'm just curious in your thoughts.
So I still think it complements. So the primary care visit, the annual exam, that's now part of the Affordable Care Act. But if you get a strep throat, a UTI, pink eye, you have to pay for that visit. And so that's where we pick up. Yeah, maybe I'll share just a little bit the entrepreneurial journey. I'll share with you the original concept, and maybe you can see how things evolve. I thought it'd be perfect to take a virtual student health center. I thought I was going to be able to go into college campuses and operate their student health centers virtually, because what's happened is when your children really are going to college, they can actually stay in your insurance until they're 26. So what's happened at the colleges is those facilities are not being utilized as much, and they're now in the red. So that was what I thought going in, but then I ran into something called academic bureaucracy. And then I had to pivot. But then the model is identical, but it's a matter of the messaging, the branding, the marketing. So the AAA for healthcare came after I wanted to be the virtual student health center.
That was a pretty rapid pivot too on your part.
Yeah.
Give you credit, you've only been in business for a year.
I appreciate
so,
that.
Yeah.
Just took 3 colleges to say we'll get it to committee, and it will probably be in 2017 when we talk about it.
Right. Got it. No, smart.
Yeah,
Very
appreciate
good.
that. Kieran, yeah. Take care.
What is your value proposition to those networks and why they don't sell it directly to the consumer versus selling it to the audience?
So to the networks, or
Yeah, the networks.
so maybe this is a little bit insight into how health insurance works. Health insurance, they're risk insurers. They take on premiums and then pay out claims. They contract with the networks. They don't operate the networks. United Healthcare doesn't operate physician offices. But the networks, they contract. And so I contract with the networks.
So what about the provider? How does the provider get paid? And do they get paid enough to see the patients because the $10?
Yeah, so a lot of the cost services, what's interesting is the pharmacy is a good example. I made $8. I'm just as happy to get paid today with $8 rather than waiting 90 days for Caremark or Express Scripts to say whether or not they're going to pay me $8 or not. Yeah. So that's a value prop to the provider.
So the pharmacy is the one that covers the physician.
Same thing. Well, the physician is telemedicine, so it's with our partner Teladoc. I really don't want to go into the business model, Neil, too much. I kind of want to talk about.
I think people are interested. So,
Okay.
Yeah.
That's true.
I mean, let me. We're here to get information. Maybe
Yeah,
Shaun gets
feedback.
information. That's good too. So I'm curious, based on what you've heard so far, how many of you will go home, go to his website, check it out, with the interest of maybe for yourself, for your own personal benefit?
Oh, I appreciate it.
Okay,
That's great.
so that's great. So
That's
there's some
great.
good feedback
That's
for him.
great.
Thank you. That's valuable.
Yeah.
So,
Yeah.
sorry, is this in addition to insurance, or like say if I didn't have insurance, could I just?
Both.
Really?
We're finding half of our members actually are uninsured. So
Okay.
we've seen it actually as a bridge between health insurance through your employer, health insurance on the exchange, and unfortunately, there's a lot of people that are saying, I can't even afford the premiums, let alone the deductible if I had health insurance.
So this $8 for all kind of medicine, or is this a certain type of medicine?
So 10 or 20, so the telemedicine, prescription, vision, lab, chiropractic, dental.
So prescription, a lot of prescription costs a lot of money. Depend on what kind of.
It's all based
A
on
little
the
louder.
cost of the prescription.
Yeah, I'm sure they can't hear you.
Sorry.
Yeah.
A lot of prescription costs a lot of different money. So some prescription costs up to $10, some prescription costs $20 or $100. So are they $100 is still I'm paying the $8? Is that the correct?
When you go to the pharmacy,
Yes.
correct. Yeah. You need to pay what the dentist, the pharmacy charges you, but we've negotiated the better rates for you.
Just as my understanding, you're just $10 a month. That's all I'm
$10
paying
a
for.
month for that access to that.
And if a pharmacy is costing me $100 at some point for another insurance without you, and $10 with you, so what's the $90 difference? Who's going to pay for it? For pharmacy point of view. You get it? Because some of the prescriptions, there is out-of-pocket cost of $100, right?
So the only person, so in that example, whether you're getting teeth cleaning as another example, you would pay $100 if you don't have dental insurance. But the insurance company reimburses the dentist $50. So the dentist is happy getting $50, and that's what you would get paid. But most people without insurance go without health care.
Yeah.
And so they're not.
That's right. Okay.
Actually, I do want to share with you a little bit of just my background. Maybe that will help explain how
I think
this.
it's great.
So I was at Walmart for 7 years, and my job was to lower the cost of healthcare. And what we're trying to do, not just the consumers, but to the 2.2 million employees that Walmart was a self-insured employer. So every claim that went through Walmart paid. So if we lowered the cost of prescriptions to $4, Walmart's health plan saved a lot of money. If we had them go to a Walmart retail clinic, Walmart saved money. So translate, we just offered that to the consumers, and our goal was to help lower the cost of healthcare. So that was what my team worked on for 7 years. They're still working on it today. I'm just not there anymore. Does that make sense?
The fundamental value proposition for the provider networks is that they're getting an additional population who can never come in and spend money.
Exactly. Yeah.
Well, how's it going so far, Shaun? Are you satisfied with your progress?
Maybe this is just back to the entrepreneur question. Man, it's hard. It is really hard. Anyone from Fuse, I encourage you to keep your day job. It's really hard. Just the journey, you always leave thinking you have great ideas, but gosh, I've been using the Mike Tyson quote a lot, but everyone has a plan until they get punched in the face.
Right.
and if you guys can understand as entrepreneurs.
One of my favorites too, yeah.
Yeah, as business people, that you get punched in the face almost daily. Whether
sounds like 3 universities did it really quickly too.
Yeah, but then I just ducked.
Right. Choose a different range.
Yeah, exactly.
Cool.
Yeah, no, it's going great. Love it. It's hard. I mean, if anyone can share their entrepreneur story, I bet it's very similar.
Can I ask a question along the lines of how medical facilities and the establishment, if you will, is responding? How are they reacting to this? Have you gotten feedback from doctors and Ohio Health or elsewhere?
The president of the Chiropractor Association, they love it because they get paid today.
Yes.
And they get new patients. Dentists, same thing. The interesting thing, if you look at the backlash, regardless of what I'm doing, the backlash in medicine is actually concierge medicine. To see your doctor, you're going to now start to pay $1,000 or more. $12,000 is what MD VIP requires you to pay. So healthcare, unfortunately, is going to start to sift between haves and have-nots. And it's just, if you start to see what's happening in healthcare, it's all a reaction to, we need to make a profit, and we need to modify our go-to-market in order to continue doing that. Yeah.
Are your providers all national companies, or do you negotiate locally?
Great question. So I focused on Columbus for marketing, but the offering works nationally because Walgreens is Walgreens everywhere. So the state bird of Ohio is a cardinal, and if you take off the C and the L, you've got Ardina, and I really wanted a made in Ohio, built by Ohio company.
Good name. It has
Thank
a lot
you.
of virtues.
Appreciate it.
I spent a lot of time naming.
I appreciate that.
I endorse that one. That's
I
great.
appreciate that. And the trademarks were available, so that's always nice.
Sudhir has a question.
Yeah, Sudhir.
Shaun, probably last question. What are the good and bad points that you have seen working with Revo?
Oh wow. Oh wow.
Christy has to leave, and then we'll get the real story. Yep.
Yeah. You know, I'll the good point is, again, I'll start with the, well, the good point is they kind of, to some degree, give you a network, give you the access to the accountants, the lawyers. I had to go top-down privilege to open a bank account as a small business. It was that hard as a startup. Couldn't even open a bank account. And so having that built-in network is really good. The other thing is there are services that we need, such as information technology development, marketing services, but they're actually rounding those services out for people like us. I'm a non-technical founder, so I need IT support, and that's one thing they're starting to help me identify and use.
I hope most of you will choose to come back in 2 weeks, and I expect we'll have 4 of these in February and probably 3 in March. So we're going to just keep it going on a pace of about 3 a month. This month we've only got 2 scheduled, but Happy New Year. Glad you're here. Thank you so much, and if I haven't met you before, please introduce yourself before you leave. Thanks a lot. Bye.